Okay, so we have quickly started looking at some um, infection, imaging, modality types. So the first one we're looking at is what is known as the cystography. So let's quickly look at cystography and also talk about what is cystography. So anytime you hear cysto, just in medicine, okay, just know that it's having to do with bladder. Okay, to me that's how I try to grab all these words. Anything cystitis, cystoscope, which is for bladder, a lot of things, so it's also specialized radiographic examination of the urinary bladder. So they use it to evaluate the bladder structure, how the bladder is functioning, if there's disease condition in the bladder, several things. Do you understand? So mainly they usually use contrast. So they put something inside here, and that thing will actually help to enhance the image of the bladder. So purpose of cystography, that's reasons why I'm actually want to do the cystography, include maybe there's bladder injuries, okay, bladder tumors or diverticulas or fistulas. You want to also access if there's like a backflow of urine, from the bladder back to the ureters, then back to the kidneys. You want to access that. You want to evaluate the bladder capacity and shape. You want to monitor, probably there has been one or two surgeries that were done on the bladder, so you want to see how it is recovering. So procedures is, first of all, the patient is positioned supine, that's facing up. So the bladder is catheterized to actually allow the contrast go in. Okay, so iodinated contrast medium is the one that's usually put into the bladder, and they usually use the catheter. So x-rays or fluoroscopy are now taken. So images can be captured as the bladder is being filled up or as you are trying to urinate. Do you understand? So after the procedure, you also make sure that all the contrast that was put into the bladder is drained out, okay, and the patient is monitored for any discomfort that might come up. So radiographic findings is normal bladder is usually smooth, symmetrical, that the shape is the same. So if there's abnormalities, probably extravasation shows that maybe there's bladder rupture, irregular feeding defects, outpouching show that there's diverticulars, and if urine is flowing back, that you have a uretral reflux.